My name is Lily Tsai, and I'm an OBGYN with a subspecialty in gynecologic surgery. So I grew up in a small town, and my parents were pharmacists. So I grew up behind the counter of this small town drugstore, mom and pop shop, and just saw a lot of ill patients throughout my life, and that motivated me to go to medical school. Then after medical school, I was a rape crisis counselor for a couple years, as well as worked at Planned Parenthood, so that geared me towards a women's health perspective. And for OBGYN, it's a perfect combination of surgery, if you want to do that, clinical work, and taking women from birth of her family all the way to the end of life care. So it's a perfect fit, I think, for me. We are all about 100% patient care. So everything we do is focused towards making somebody comfortable to be there and make sure they have all their questions answered before leaving. So I do a combination of office-based work as well as surgery, and the main surgeries I do are minimally invasive gynecologic surgery. So that includes robotic surgery and laparoscopic surgery, whether it's hysterectomy or a large ovarian mass or fibroids of the uterus that need to be resected. And the two just interplay very well together. The office is the place to diagnose, counsel, and if the patient wishes, to take her to the operating room and deal with her problem. Most studies show that if you videotape a physician doing their first exam with somebody, they'll cut somebody off usually within 30 seconds, definitely less than a minute. So I've tried to consciously allow somebody on the clock to talk for minutes at a stretch to get them to let me know what the issue is. Because truthfully, most of your diagnosis is 80%, 90% history taking. And that comes from the patient, not from things that the doctor makes up. So I think my role as the physician is to provide an avenue for patients to be able to make the best informed decisions for themselves. So I'm not there to say, you need A, B, and C. I'm here to say, this is the process, this is the problem that you're having, and here are treatment options. What do you think works best for you and your family?